This is the third day, and I wish you a good day today. Ledazone of Lurasidone. Last year, together with Professor Köksal, we have discussed this Ledazone topic. Human beings are afraid of what they don't know. Therefore, promotion is very important. Introduction is important. For a long period of time, there was some vicious circle about the new pharmaceuticals or drugs in the pipeline, but recently, Lurasidone and a couple of other molecules came into play, and gradually we started using them, and the results we had were quite promising and encouraging. And there was a period of time that I was even a little bit pessimistic for a period of time. Combination, polypharmacies, and we were trying to save the day. But many patients could be resistant, and the more different type of medications you have, then adherence to the treatment is distorted or damaged. Therefore, instead of these novel new molecules became a hope for us. And after the promotion in the last year's Congress, and I believe, including me, more physicians, more colleagues started using this. I would like to thank Sanofi for organizing these promotional events. Many thanks to Sanofi. First, I will speak a brief, very brief bird's eye Lurasidone in a nutshell as a molecule. Later on, my colleague Köksal, Professor Köksal from 9 Eylül University, he will tell us case studies about Lurasidone. Later on, we will have a Q&A session at the end of the satellite session. There will be a Q&A part that will finalize. I would like to thank you for your participation in advance. So I presented myself. Now I will move to the podium to speak. Lurasidone is a new hope, as I said a while ago. After a long period of despair, new formula appearing, that's very good. In 1952, after chlorpromazine, new molecules were invented or discovered. And it was a revolution for psychopharmacology. Age started. And those hospitals were, although there was no stigmatization, the patients came into social life and they could interact with the rest of the society. But as I said, for the last 2 decades, in the last 15 to 20 years, there were no new products in the pipeline, and this caused some despair and some pessimism. Now, a new hope, Lurasidone is a new hope and promising one. And together with that, the new generation antipsychotics are listed there, and Lurasidone's history, FDA approval. In 2003, this was synthesized, and for adult psychiatry, acute and maintenance treatment of schizophrenia for 2010, and for bipolar and depression 2013, for child and adolescent psychiatry since 2017, for schizophrenia starting from age 13, and for bipolar and depression from age of 10 starting 2018, and started use in Europe starting 2016. Pharmacodynamics of the drug, it's classical D2, and which one? The pointer, figure out. Yeah, this one. D2 and classical and widely known, the second generation antipsychotics and serotonin 2A antagonist effect and antipsychotic impact or effect, and strong antagonistic effect with serotonin 7 and antidepressant precognitive impact, alpha 2A and alpha 2C antagonistic effect with antidepressant impact. And with partial agonism mechanism, there is antidepressant effects, and there is no antihistaminergic impacts. Therefore, weight gain or sedative or antimuscarinic adverse or side effects are eliminated. And pharmacokinetics, a peak level 1 to 3 hours at serum level, blood level, and it should be taken with a minimum of 350 calories food, and this increase its emission, and the stability level is 7 days, and the half-life, elimination life, is 20 to 40 hours, and a single dose per day. Therefore, it's easy to use, user-friendly, and Sticrum 450 and 3A4 metabolized. Therefore, we will talk about drug interactions soon. The starting the dosage for schizophrenia is 40 milligrams, and daily goal is, depending on the patient, 40 to 160 milligrams. For bipolar depression, 20 milligram per day starting dosage, and a single dose a day. And depending on the side or adverse effects, soon my colleague Köksal will elaborate, can be taken at nighttime or morning or no. Meltzer's study shows the olanzapine together with olanzapine an equivalent effect with and much better than placebo as antipsychotics. And for maintenance treatment, Lurasidone's best sides, one of the best sides, its metabolic side effects are not there. Very low, even lower than ziprostone. As you see, this meta-analysis, it's advantageous, and that's not about it. QT prolongation. It doesn't cause QT prolongation. Therefore, for heart or cardiac diseases, for arrhythmia, it can be used safely. Many of the medications here, QT distance is elongated, and it has side effects for arrhythmia patients, comorbidities. For instance, I had a bipolar patient, and Köksal, my colleague, will elaborate diabetes and arrhythmic disorder, heart rate disorder. And when we started this drug, it was in manic stage and much better. And there was no convulsions, and it was in a senior patient and the older patient, and much better results for him. Besides, sedation, it doesn't cause sedative impact. Compared to antipsychotics, it's much better in that terms. Olanzapine, quetiapine, chlorpromazine, and chlorpromazine, they have more sedative impact compared to lurasidone. And treatment-resistant cases, schizophrenia-resistant clozapine is used, and it's an add-on medication needed for clozapine, and it's promising for that also, promising results from those studies. Some special treatment groups, there should be special considerations for senior patients. It should be around 20 milligrams dosage for hepatite deficiencies and renal deficiencies, max 40 milligrams for pregnancy. Risk category is labeled B, category B for pregnancy risks, and that's only clozapine, as widely known. For all antipsychotics are C or D categories for pregnancy. Therefore, it can be safely used for pregnancy, even be used for pregnancy, and it's quite promising in that aspect too. Can be used together with lithium and sodium valproate, and together with oral contraceptives, and there are some cognitive impacts on lamotrigine. What needs to be paid attention, considerations is Stockholm and inhibitor enzymes. The fungal drugs are clarithromycin and grapefruit also, and enzyme inducers, St. John's wort. Many patients ask, should I use or take it? But it should be very carefully, because this may reduce the effect or efficacy, and carbamazepine is becoming less and less used, and it's categorized. It increases decreases the blood levels. And in Lurasidone, transition to Lurasidone, what needs to, it should be stopped slowly. It should be slow decrease and slow reduction and slow increase. Some strengths and similarities to second generation, efficacy similar to second generation antipsychotics, a very mild or very little weight gain, but it doesn't have affinity to histamine, therefore less, and sedative impacts is on antihistaminic affinity, and it's also not there. Metabolic hyperglycemia, hypertension, and hyperlipidemia, and weight gain very low, and sedation is almost no, and orthostatic hypotension is also low. Many of the antipsychotics, lisperidone, widely known one, and quetiapine, they have high hypotension. For elderly patients, this could be a real problem because falls and bones breakages or QTC extension or prolongation. It can be used for patients with arrhythmia. Prolactinemia is a problem for child and adolescents and young people. Therefore, many of antipsychotics, because of these side effects, the patients may drop out. In Lurasidone, you have lower prolactinemia, procognitive and antidepressant effects, and this 5-HT7 antagonism mechanisms and muscarinic receptors are not affected, and no affinity to histamine 1 and pregnancy category B. And as transition to antipsychotics, there is smooth transition based on my observations, and colleague Köksal will tell during case studies. And if I may summarize, it is only for schizophrenia acute and maintenance treatment, and as FDA approved for a long period of schizophrenia acute and maintenance, and for bipolar depression for children, for schizophrenia starting from 13 years old, and for bipolar starting from 10 years old. An alternative in the first episodes, I don't know, maybe colleague Köksal may have patients, and this may be used. Mostly I view it as a transition to when other antipsychotics cannot be tolerated because of arrhythmia or sedative impacts or diabetes. This can be an option. When clozapine is not enough, the treatment-resistant schizophrenia, it can be an add-on medication. Thank you. At the end of the presentation, there will be a Q&A session, as I said, and we will have an opportunity. And over to my colleague Köksal. Thank you. I would like to thank dear Mesut and to Sanofi brand or company for inviting me as speaker to their session. There is a good and fine weather. Everyone is around the pool bar enjoying their drinks, and you are here with us. And I would like to thank the audience for taking their time and joining us. For around 1 year, we have been using Lurasidone. And now I'm getting to learn this molecule, and I had some good results, and I will tell you some of the positive cases where I had good results. As Mesut Bey rightly defined, among the existing antipsychotics, what makes Lurasidone different is some receptor characteristics. One of them is it's an 5-HT antagonist and 5-HT7 antagonist and 5-HT inversal antagonistic impacts. These characteristics or specifications, Lurasidone shows antidepressive impacts, and it improves the cognitive functions, and this increases the functionality of patients in their daily life. As Mesut Bey rightly said, for the acute and it's a safe and efficient disease, and for bipolar depression, FDA approved indications and antidepressive impacts and increases the cognitive functions. Another important advantage is schizophrenia patients uses it for long term and for the metabolic and weight control and negative even. It can reverse the negative impacts of other medications for weight gain. APS, QTC changes, and hyperprolactemia, no negative impacts in that regard. The most important negative impact that we see is akathisia and sedation. This can be 10 to 15, and this can make a difference for those who causes sedation, mostly after dinner. But mostly I'm prescribing it to the patients for after breakfast in the morning because it's invigorating impact. This was recently published a couple of months ago, a Spanish study. The four hospitals in Spain, their health records were studied. And from 2019 to 2022, all patients' medications were evaluated in this study. And these health records of the patients, that only the patients using Lurasidone is not taken, their treatment process is also studied here. The total number of patients is 2 million. Using Lurasidone is 272. Many of them are for schizophrenia, 95. Another area is depression and bipolar disorders. Bipolar depression mainly, frequently used. What is striking for me in this study is that patients' mean age is 45. That is, Lurasidone in Spain is used in later stages of the patient's life. For monitoring periods, lirasidons for schizophrenia, equally, and others, the significant improvements and recoveries, positive and negative symptoms. The one in orange color is diagnosis other than schizophrenia. Green or bluish one is the schizophrenia-related. Both the negative and positive symptoms are improved. Anxiety and depression symptoms are also 50% improved. It has those efficacies. Lurasidone can be used for different type of patients in different stages. Acute period first for adverse effect or negative or side effects. Using it in adolescents or young patients is important, as Spain in expert had a cooperation report for the experts working about schizophrenia gathered, and Lurasidone and the use of Lurasidone, they made an evaluation and assessment for acute patients, both the safety and adverse effects advantages. It could be a frontline or first front medications, Lurasidone, and positive impacts on substance use, patients with substance use, those cravings. This is an additional advantage of Lurasidone. This is my patient. This is a young female one, and she was staying with the friends at hospital, and with a psychosis narrative of 2 weeks, and there was audio hallucinations that is criticizing, and there was beheaded necks, and they were talking about it, and they were calling her prostitute, and that she was a prostitute. She was never going out, and there was fear of being arrested and being imprisoned. There was excess anxiety. 6 months of substance use, and this was an acute stage. And 40 milligrams Lurasidone started, and 2 weeks later, increasing it to 80 milligrams. And there was distinctive or significant decrease in the psychotic implications, and there was no severe side effect.
Bileceği alan Another area where this actually where the Lurasidone can be used, and actually alcohol and the substance used accompanied with the schizophrenia, and actually, of course, the first choice is the long-term antipsychotic medications, and actually, so here, as we see here, that there are some differentiation about the violence, and also, and actually, so they are and so it to get together with the voice and the mouse, and so here, and you see here there is an remarkable decrease, and this is another study published in 2002 and 2022 for where is a series of the incidents for patients, especially on the cannabis related psychosis, and uses cannabis induced psychosis when together, and a novel therapeutic strategy, and there are not too many studies on this area, and especially for the first episode cases, and Lurasidone is considered to be one of the medications that can be used, and actually we here is the side effect benefit is really one of the reasons why we should use the Lurasidone on this and so and Luprestone and Lurasidone here, and they are significantly on the reverse side of the normal, and so it can create some weight loss on the patients, and however others and as we know that the others can cause the weight gain in the other bits. And however, even though actually the dose increases, and so actually this in the long term, it is a really an important issues, and because the patients may suffer from some cardiac issues, or even it may cause some mortality in the long run. That is related to weight gain, and I sincerely believe that. So, and of course, which medication causes which kinds of consequences on patient, and in this case study here, and actually, and I have been monitoring this patient for a long term. It's a 30 years old female, single person, graduate from university, working as a HR manager in a private company, and actually psychotic life starts after a substance use, and most striking part is so very she is suffering from the audio schizophrenia that characterized her in female and male voice format, and therefore she was terrified. She cannot remain alone, and actually together with the actually that there was no response to antipsychotic in the efficient dose, and together with the clozapine sedation and the partial elevation occurred, and the most beneficial olazapine, and however causing the severe psychotic lives, and increased in weight, and actually so she has started to use Lurison for the last 6 months, and there was a significant improvement, and the voices she used to hear has decreased, and functionality decreased, and the weight gain has stopped, and she lost even more between 1 or 2 kilos, and she actually also she also got closer to one of her boy friends that she knew in the past, and actually, as Mr. Mesut has already mentioned, so it can be a supplementary, it can be used as a supplementary treatment to clozapine. We can also, quetiapine can be listed here in schizophrenia, and so there can be overlapping effects of these agents, and this in this case is also long-term monitored patient, and this occurred together with the clozapine, and so I have also tried many other medications for this patient, and he's 36 years old, male, female, industrial engineer, and he couldn't work at any job in spite of graduating from university. And so actually he has very intensive psychotic anxiety attacks, and so he hears the voices as well, and he always considers doing something wrong, and therefore he confines himself at home. And of course and actually he used to be in 1780 kilogram. Now he is 130 kilogram at the moment, causing from the clozapine. And actually we are using efficient dose of Lurasidone as a supplementary use of medicine with 160 milligram per day. And so there is a significant improvement in life. And he started to say that so the voices that he hears started to be getting lesser and lesser, and therefore Lurasidone can be an ideal medication for this patient. And also this depression accompanied with the schizophrenia, and so it looks like also a profile that may work for this combination as well. There is a review study, and actually it manages depressive symptoms in people with schizophrenia. And actually, of course, it looks at the changes in the scales that works with the depression, and it also provides some level of improvement. And another indication, of course, it is not the minister has not give this license for this bipolar depression. And in bipolar depression, so in many bipolar manuals, and actually it is one of the leading together with lithium, and it can be used together with the lithium and Lurasidone lithium and lamotrigine as well. And it can be a good combination with others. And I have a bipolar 2, and who is hospitalized frequently with a high suicidal risk. And because there was a very high suicidal burden in the family. And actually it causes, as we know, that so actually we have to hospitalize this patient in order to protect her against the suicidal risk. And that there was actually 3 or 4 cases of completed suicides in her family history. And therefore so he has very high rate of hospitalization. And he, in addition to lithium and decapine and quetiapine, we have added Lurasidone. And after the Lurasidone, and so there was a remarkable decrease in the suicidal ideation and the suicidal thoughts. And actually there was no new hospitalization record after starting the Lurasidone for this specific patient. And actually one of the areas, especially where the Lurasidone should be used, is the adolescent psychosis patients. And that there are 2 reasons for this, and especially for the acute patients. So it is an efficient medication, and it is a highly safe medication. And this is a newly published study on 2 adolescents and young adults with schizophrenia. And when we look at from the effectiveness side, and this gray area, it is the double C area here, and the other one is double blind cases, and the one that you see as the purple or the red. And so they are they are changed from the PBO to Lurasidone. And you see here, as you can see, in 1 year's time, and they have a benefit from the Lurasidone. And so in this 1 year time, when we look at from the past scores, and actually uh, the improvement level is the 60%, and here, as you see here, and it is the remission criteria of the remission, and the rate is 60%, and the Andreas remission criteria, as you saw that, and the psychosocial improvement criteria exist, as we know, in addition to other indication of improvement, and together with the Lurasidone. And so in we have and it is possible to say that two of these three adolescent patients have fully recovered in this period. And as we know that so Lurasidone, especially for the total weight gain, and it is also efficient, and for the glucose, actually for the prolactin it is 1.3, and so they are definitely negligible actually. And as we see in many of the areas, there is a reverse impact. And as you see here, Lurasidone is a really safe medication, and it is another adolescent patient, and so for adolescent schizophrenia, and so a systematic literature review. And we see here that there are some metabolic problem causing patients. Another case presentation, it was a 16 years old female, and she was extremely obese person, and she was hospitalized a lot to in many different centers, and she has very intensive psychotic lives, and she used to see genes, and she also sees some cardiac issues. She suffered from very high anxiety crisis, and and she started to use clozapine, and she received partial effectiveness. And however, because of the cardiac and the metabolic side effects, they discontinued this drug. And after 5 months of time, they have applied to me, and after Lurasidone, starting the Lurasidone with the 40 milligram per day. And so they thanked to me actually. Actually, I haven't seen him for the last quarter. And another exceptional experience that I have experience with especially for the non-indication use, because we and so this is a patient living abroad, 15 years old female, and it's a unique child. And so she has common developmental disorder, and the family was completely sad, and she has very aggressive attitudes, and she is harmful to herself and to the environment. And so she has high attacks, and so I couldn't understand what she was saying during our interview, because she had also suffering from the sleep disorders. And so actually, so she and for example, she was masturbating in front of the others in the family environment, and they tried many antipsychotic drugs beforehand, and she was receiving the special education, and she was very dependent to her mother. And so I started Lurasidone 20 milligram, as she also used, and actually, and so I was not too much aware, but I was just curious what it will evolve and evolve into. And 2 months later, I have received from the mother, and her mother responded to her sleep rhythms and sleep patterns are better, and especially, and actually there are some autism efficiency studies, and they seem to be negative. And however, I have observed such a change in this particular patient. And lastly here, entering the especially for the lactation mothers, and so as you know that it is very binding for the so it is it is attachable to the lactation-related enzymes. And however, I believe that especially for the high plasma proteins, and so as actually I believe that it is not too much transferable through the milk to the mother. And actually, finally, Lurasidone can be actively used for the acute schizophrenia and for the continuation period. And I consider it as a new hope and especially for the receptors and so the cognitive uh, for cognitive side, it can make a difference, and especially it has very important advantages compared to side effects. And that was all from my side, and I would like to thank to you, all of you, for your participation and for your questions. And if you may have any question or if you may have any experience, because we really would like to get your opinions and your experiences as well in this regard, please feel free to take the floor if you have any question or comment to our speaker. And I am Oğuzhan Bekir Elmez, and coming from the psychiatry department of Adıyaman University. And actually we have very few experiences in regard to Lurasidone, and thank you very much for sharing your cases with us. And as you know, when we want to shift over from some other antipsychotics, for example, clozapine, and for example, so is there any table, for example, for dose arrangement for when we shift over? And there are some equivalent doses. And do we have any equivalent dose definition from the shift over from the other and actually it is, and for it is you have to go to 50, 80 for the schizophrenia patients. It is and 160, and it is between 10 to, and actually for the olazapine it is between 10 to 20. And so actually it may be risky to go from the legal point of view to go to the 20, but. And thank you very much indeed for your presentation. So I would like to ask about mixed indicated depression patient, and so is there any acadesian effect if you start with the 40 milligram per day, for example? And actually the utility use, and for bipolar depression you need to start with the 20, and however for schizophrenia you need to start with the 40. And academia side effect, it is person dependent, it is not directly patient. So and and actually that you have not observed in the 20 milligram per day, so you may you may observe it in the 60, for example. So the upper limit is considered to be 120 actually. However, so you need to increase from 40 to 160. And if you see the no response, it is not true say that the patient has not benefited from it at all. And however, academia, it changes from the person to person, as I told. And thank you very much. It is really a good presentation. I have benefited from, and so we have very few weapons in our hand, and so actually with the we have. And especially for what about for the elderly patients? I work generally with the elderly patients, and is there any study for using with the elders? It's a very nice question indeed, and however, we don't have any study yet using. Maybe if they have any experience or review or study, they know our international guests may contribute to our discussion here. And it seems that it is because of the EPS side effect, it seems to be not convenient for because it blocks the dopamine, and so therefore for the elderly patient it may not be indicative. And maybe in Canada, for example, it can be very new And what do you think in Canada? So do you use it for the elderly patients?
This compound in the elderly, but it makes sense if it's a dopamine blocker that the concerns are going to be around extrapyramidal symptoms. Yeah. Have to be cautious without a study.
Yeah.
Thank you.
Katılıyorum.
Totally agree with him. Actually, from the Japan, there's a very recent review and study, and so actually, especially acute dystonia is one of the most complicated, most reported side effects. And I haven't used for the dementia, and however I have used in for the elderly, and I have received really good results. And so, as I told you before, as it does not cause too much sedation, and so I have seen good impacts. And actually, 20 milligram doses can produce really good results. They are dementia or schizophrenia, psychotic depression patients, and actually remission period of the bipolar disorders. And actually, we have a lot of schizophrenia patients in elderly patients actually. So I think there is a really need for performing studies on this area, and actually quetiapine and actually quetiapine creates sedation. I have many fall down cases on the elderly patients. So quetiapine actually, even though it is very highly used, and as we know, the falling down is, and Parkinsonism actually is another reason. And olanzapine also in long-term use of olanzapine can also induce the Parkinson as well. So these are really, these needs to be taken carefully. And so child psychiatry of the Medeniyet University, and uh, I have 8. I think you can hear me better, right? Right? Okay. My experience is the non-indication, out of indication use as an alternative, and so we have, especially for the anger control, and uh, so we used it for the adolescents actually. And Listeridone was useful, and because of the sedation and the appetite side effects, so we shifted over to Lurasidone, and actually shifting over was resulted from the efficiency, however, from the efficiency point of view, I haven't seen too much difference from the Listeridone actually. So what about the prolactin augmentation? And so actually, so prolactin in, increase was case in 2 cases. That's why I've shifted to Lurasidone. But however, I haven't observed too much difference in terms of efficiency, actually effectiveness. And of course, we believe that actually, how and where and are they? So yes, they are acute developmental disorder people, and intellectual deficient people, and actually, if this patient, if you monitor these people with any particular particular measurement scale, and first there's a controlled study, and it's a placebo controlled, and there is no effect. And but I have observation, and it overlaps with your observation, and about the hyperprolactemia, and Lurasidone has no activity on the hyperprolactemia actually. And I cannot remember the country, but in one of the countries, and after the cohort study, and one of the signals was, and there was a serial of cases causing the hypoprolactemia actually, and there is a, and actually how the dopamine blocking agent can cause hypoprolactemia, they say. And so, and actually it's That is why it seems to be a safe medication for the adolescents, of course, but it needs to be explored as well. And actually, the Social Security Authority has finally approved this medication, and of course together with if they have any diagnosis with the schizophrenia, and actually we cannot put this indication up until there is a 6 months of period, and therefore we need to discuss it with the parents and also family members of the patient. And is there any other contribution or question? I think two people at the back row. Dr. Tuna from the university, and actually myself. And I was following very closely Lurasidone, and I started to use as soon as it entered into Turkey. And I haven't used it for the psychosis at the moment. I didn't want to take any risk because it was. And what sort of risk did you expect for non-responsives, for example? Because olanzapine and others. And actually, there are many, and I can send you send you study results because there are uh, many studies that provides evidence for the efficiency of the Lurasidone for this adolescents and child psychosis. And I actually I have experience with around 200 patients, and especially for the program related symptoms of the bipolar. And for example, if the mother is bipolar and the child is depressed and without any mania, and so in such a cases we avoid from the antipsychotics, as we know that. And actually in the past I used to work in France, and I used to use quetiapine for such indication. And the quetiapine causes too much weight gain and also too much sleep. And for example, during the university entry exam period, it could be it could jeopardize the school rate of the children. And after I started to work in the Ege University Hospital, and we are using the Lurasidone actually. So we are regularly monitoring these 25 five patients that we have used so far. And so actually for the bipolar depression or the unipolar depression, and if there is a bipolar burden on the family, it can be really used in an efficient way. And the most actually nausea, as we know, so it is the one of the most important drop reason for Lurasidone, and it cannot be tolerated, and it does not actually remiss, and because the adolescents don't like this, and also it causes sedation. And therefore I think by administering the drug in the late hours of the night, and as it also facilitates sleeping, and it is suggested to take together with the dinner actually. And so in such cases we didn't have too much problems. That was all I can share with you, and thank you very much indeed. And after the so if there together with some milk and with some cheese, and so you can get this 350 calorie, so that will be sufficient for the dieting at night. Ayten Yüksek from the Mersin University Hospital, and I have two questions. And about the Lurasidone, so if the resistant people, the schizophrenia, clozapine is one of the leading agents that we use, and however, and can it be an alternative to clozapine in the long run? And so as we are working in Mersin, alcohol substance use is very high, as you know, for the Adana-Mersin region, and for such patients, and for example, starting not for the for, and actually AKTZ, starting with the AKTZ, and instead of starting from the 40 milligram, if we start with the 80 milligrams, I have seen is some severe side effects, and but especially for the selected cases, I haven't seen an issue, but I have observed these issues, especially for the substance and alcohol using patients, and actually. We need to think that for such patients and none there are sub-disease groups, and why clozapine is indicated. Maybe it is we need to think as non-dopamine related mechanisms need to be taken into consideration, and so dopaminergic system may be normal for some psychotic patients, but lurasidone is not too much different from the second generation medications in that aspect, and in regard it may be related to alcohol and drug use, and in all other patient disease groups, and apart from the schizophrenia, they are susceptible and sensitive to these effects, but as I told you before, we cannot use during the acute phase. If there is an akathisia, we cannot use it at all.
Also agree that it is irreplaceable in most cases. In terms of mechanisms, there are many mechanisms, and receptors even work with clozapine. So only additional treatments with in terms of psychotics, maybe with to decrease salivation or maybe insomnia or other things. But honestly, I agree with Köksal. It is irreplaceable, sort of. I ask this because for a long time I had a patient that used clozapine, and it developed necropsy, and there was a remission in clozapine. So this happened. So because of that, I mean, it had a history of antipsychotics already. So clozapine replaced by drazapone had seen a dramatic recovery without any issues, and this was also a panel I had in anxiety congress bit. So that was my basis for asking this. In terms of mechanisms, if there's a lethargic issue here, you know, not benefiting from antipsychotic, but only from clozapine. So, but after 5 to 6, when I started drazapine, I see a dramatic recovery, and that made me question it. So, could be temporary. I mean, be careful. Of course, yes, it's been in remission for 8 months. Perhaps even 2 years later, it could have a relapse. Yes, for a pharmaceutical company, its biggest challenge is medicine in patients. If they overtrust or undertrust, that's a problem. I mean, medicine, up to this point in research, placebo controls have been made for certain things. So I don't have an exact research, but this could be a special case in your hands. I also want to add to the resistance and agrenstos, and there's similarly rheumatoid Strand-Johnson syndrome and other things here. I add these because they are things that could be identified with genetic therapy, but it's expensive in Turkey and usually not state sponsored. So we have the ability to identify them beforehand. And in Hall 2, we will have genetics discussed in Hall 2. So we expect you there in the next 15 minutes. Thank you. Oh, one last thing, especially in clozapine receptive and then having a recess, treatments might go bad. It usually does, and adding lithium to it could be better, especially to, let's say, correct the values of blood. Yeah, I have to end the session now because we will have a 15-minute break, and then we will continue with our sessions. Thank you all, to Köksal, to you, to everyone, to Andy. Thank you.